golf. I can tell you a little bit about myself, however, relative to golf. I live in Chicago, which is clearly not a year-round golf city. But I have started to learn about golf, and I've gotten very interested in golf itself, and also being a podiatrist, I've gotten interested in the biomechanics of golf and what that might mean both for a podiatric physician and also what that might mean for those involved in golf, whether students or even pros or teachers. So it's been an interesting journey. I'm no longer a beginner, but I'm certainly not quite at the intermediate level as a player. But I also have come to realize that a lot of the golf instructors really don't know much about the biomechanics of golf when it comes to the feet. So as many of you know, golf is a game that is challenging. It is dependent on many, many factors, certainly weather being one of them, but a lot of factors that we as podiatrists can and should start to consider as you start to think about patients that may be golf players. But I can tell you, I love golf. Being outside is wonderful, it's freeing, it's challenging, and it is very analytical, again, both as a player and as a podiatrist. So the first thing that I want to talk about relative to biomechanics is the concept of sports that are triplanar. And I know that most of you guys, as far as your training so far, you've been exposed or at least introduced to the planes of the foot. And when we're talking planes, we're talking motion that occurs around an axis. And we all know that with the foot on the frontal plane, there's inversion and eversion. On the sagittal plane, you have dorsiflexion and plantar flexion. And on the transverse plane, you have adduction and abduction. So those are terms that should all be familiar to all of you. And the triplanar terms relative to the foot should also be familiar: supination and pronation. So keep in mind that that's just the foot. As you learn more about the body parts, as you go up the body, you're going to learn about internal and external rotation. You're going to learn about rotation of the tibia. You're going to learn about rotation of the hips. And keep in mind that there is triplanar rotation of every body part, whether the upper extremities or the head and neck, or the body as a whole. And golf certainly takes that motion of all body parts, and it is dependent on our ability to have triplanar motion of each body part and then of the body as a whole. And we're going to talk a little bit about the planes and a little bit about the function of the foot and how it relates to golf. So one thing that I noticed when I first started getting into golf is that biomechanics is really, really strong in the golf world because of all the things I just said. The motions that are necessary for golf, the swing has been and continues to be analyzed in so many different ways, but most of it has to do with the upper body, the wrist, the arm, the upper arm. All those things together create the extension for the golf club, for the swing. But golf isn't just the upper body. Golf comes from the lower body. And most of the research that's been done in publications are on the hips. There's very little that talks about the foot, and really almost nothing that talks about foot pathology and foot function relative to the golf swing. And that's really where I've become interested. I am not I do not have experience in research, and I have, as you'll see as I talk, I have some ideas on research that I would like to explore And I played around a little bit with beginning explorations on different components of foot pathology. But that's really mostly just for my information. And I think this is a field that really deserves more research than has been applied to it in the past. Okay, so some things to consider relative to the lower extremity that I have gone through in my mind, and things that I would like to see explored would, number one would be foot type. So we know from our studies in biomechanics and our studies in pathological feet that the cavus foot and the pronatory foot all have differences in ability to provide necessary motion for gait, right? A pronative foot is hypermobile. A cavus foot often doesn't have enough pronation. So the foot type can definitely influence the amount of motion that is available for anything, whether it's gait or a specific sport, but certainly anything that requires triplanar motion, such as golf. So there's really been no research that talks about foot type relative to golf. And I think that's a huge area where that can be explored. And then even tibial varum or metatarsus adductus. So anything that is superior to the foot, that affects the foot, any positional deformity really can influence our ability to swing properly and to maximize the golf swing to the full potential of a golfer. Then there are those pathologies that I think can influence swing. Certainly arthritis. When we have arthritis in the feet, when our patients have arthritic feet, it changes your ability to do anything that requires stance or walking or running. Individuals that have arthritic first MPJ joints have a difficult time running. And runners that have a hallux limitus will quickly worsen that hallux limitus, and often it becomes a hallux rigidus because the constant jamming and the constant demands of that joint that exceed the ability of that joint to give the range of motion needed for something like running will cause additional arthritis. So golf is no different. Golf requires joints to perform in certain ways. And if that joint motion is not available, it's going to limit how much of that activity you can do successfully. Or your body's going to have to find a way to compensate for that. Tendon pathology. One of the big things that if you haven't learned yet, you will learn about are tendon pathologies. And the posterior tibialis tendon is a major tendon that causes all kinds of pathology in adults, especially as they get older. Certainly people that are overweight have additional forces on the posterior tib tendon, and any tendon pathology within the posterior tib can affect the foot function. It can affect the support of the arch. It can affect walking and certainly sports, golf included. So tendon pathology is something that is not only gonna affect the way you function, but it is definitely gonna affect and influence the ability to perform in a sport such as golf. So looking at from the opposite direction, not only can tendon pathology influence your swing or your ability to perform well in golf, the way you golf or the way you swing can influence pathology of the foot and ankle. Like any sport, you can have an overuse injury, which what that means is that when you use a body part, such as a tendon, too much or ineffectively, or you are repetitively putting a strain on that body part, you can develop an overuse injury. A classic example of that you guys probably know about is a stress fracture of the metatarsal bones. When a body part, such as a bone, takes more stress than it can absorb, it's going to become injured. In the case of a metatarsal, it's going to be a stress fracture where the bone and the cortical bone starts to splinter and starts to give in response to the extra stresses. When we're talking about a tendon, it's very common, especially for the posterior tib tendon or the Achilles or your peroneal tendons. When they accept too much stress, they can tear. And I don't mean a full rupture, I mean slight tears. And as that activity continues without allowing the tendon to heal properly, you can start to get scar tissue. And you can start to get fatty degeneration of that tissue. So it's very, very common to have tendon problems in people that are active. And if their biomechanics are not properly supported, those tendons can worsen and you can start to get chronic pain. So we see that in not just in golf, not just in sports, we see that very, very often in people with chronic pain. It comes down to tendon pathology. And then we'll find so many people that have had ankle fusions or first MPJ fusions. Very often, these are older people, and the golf population, not that it's only older people, but certainly a lot of people as they get older take up golf. And a lot of golfers can't wait to retire to really get into their golf game. And certainly arthritic conditions or joints that have been treated with fusion because of their arthritic conditions are that lack of motion at that joint is definitely going to change the way you golf. And again, really these types of considerations have not been studied at all in the field of golf. Okay, so a logical place to start when we talk about the effects of any sport on the foot is to start with the gait cycle. And I think you guys have probably had the basics of biomechanics at this point, and you know about the gait cycle. So you've got a period where you have single support, meaning only one foot is holding the body weight. You have periods of double support, when both feet are maintaining the body weight. And during the time of single support, you have swing. The foot that's not on the ground is in swing, and then you've got stance, which is from heel strike to heel toe, and that makes up the gait cycle. How this differs from golf is that this is linear gait. So golf is, while some of the biomechanics are similar, it's not linear. I mean, obviously, when you're walking hole to hole and you're walking to your ball, then it's linear gait. And certainly we have to support the foot and think about the foot function during those times of walking. But during the actual swing, we're not talking linear gait. We're talking motion that is not normally what we think about when we're learning about gait. But it's a good starting point. So some things to remember about gait that, and I say remember, but really these are key points that we don't necessarily learn about because they're not the standard talking points about the gait cycle. But they're important when it comes, especially when it comes to golf, because there are more components to the gait cycle than we're taught as the basics. Okay, so first of all, gait is not going to be the same person to person. There are generalities. Your 40%, your 60%. There's generalities of how the gait cycle works, but that is not necessarily the same person to person. And the right foot and left foot may differ depending on your foot structure and the available motion in each of those planes. So the right foot and left foot can definitely be different. When it comes to golf, the right foot and left foot have two entirely different roles. Again, golf does not involve progressive, linear, straight gait. It involves motion that is more with rotation and shifting the body weight. So the right and left foot have two entirely different roles. Gait not only produces triplanar motion of the feet, it produces triplanar motion of the entire body. When you are walking, and this is in terms of straight linear gait, when you are walking, you are moving up and down. You have a vertical motion of the body. You don't, if you were to look at someone walking, as their foot position changes, the position of their head relative to space is going to change, meaning that is vertical motion. The body is moving up and down. The body is also moving side to side. So your body is shifting medially and laterally on each foot, and it's shifting to the right and to the left laterally relative to the center of your body. So you've got vertical motions and you've got side to side motions of the entire body as you walk. And you also have the forces and the motion and the movements from your heels to your toes. So the body is moving in all kinds of directions. You have forces from the posterior part of your body to the anterior part of the body, or proximal part of your foot to distal part of your foot. You have rotations of every body part, including your hips, your femurs, your tibias. And as you move, the center of gravity is moving with you. So all of those things become really important in golf, as well as with straight linear walking. Okay, so what are some other things that make golf unique when we're talking about gait? First of all, one of the things I wanted to mention also is that there's two terms that you may already know about. One is called closed kinetic chain, and one is called open kinetic chain. And closed kinetic chain is when your heel is firmly planted on the ground. And the talus and calcaneal relationship and the talar and tibial relationship changes whether your heel is on the ground, meaning closed kinetic chain, or the heel is off the ground, meaning open kinetic chain. So there is a dynamic relationship of the talus relative to both of its articulations, proximally the tibia and distally the calcaneus, depending if the ground becomes a factor in the motion of the talus. And that happens whether you're talking linear gait or something that is other than linear, such as with golf. Okay, so ways that golf is different. Number one, you've got a lot more lateral motions, meaning you're moving side to side. So the transfer of weight from the right foot to the left foot for a right-handed golfer, or the left foot to right foot, the right foot to left foot in a right-handed golfer, or the left foot to right foot in a left-handed golfer, that transition is called lateral motion, and it's transferring the weight from one foot to another. So that's different than normal linear gait. And also, the golf swing itself requires extra motion. The whole concept of golf is to get that swing and the rotational motion to build speed and to build power and force for the ball to go further. So golf is dependent on your body's ability to maximize rotation. Golf is also dependent on your ability to generate ground reactive forces. which we are going to talk into a little more depth as we go along. So a few other things to think about. Whether or not you have a normal foot type, everyone has a foot type that allows some degree of pronation and some degree of supination, but everyone is different. So even though there's a normal foot type and a normal gait pattern, really everyone is different based on their own ability to their ability and versus their physical limitations. So if someone is taller, they're going to have a longer vector for swing. If someone is stronger, they're going to be able to generate more force. If someone has a quote unquote normal subtalar joint, they're going to have the ideal amount of motion of the subtalar joint to maximize the golf swing. If someone has a cavus foot structure, they're going to have less than maximum amount of motion of the subtalar joint. So everyone is different, and the subtalar joint position, the subtalar joint motion, and anything that impedes that subtalar joint is going to have an effect on the golf swing. And then finally, what we talk about with the biomechanics or the kinetics of golf is that golf starts from the ground up. So the relationship of the foot to the ground is a very important factor when it comes to golf, talking about ground reactive forces. And when I say starting from the ground and moving upward, it's about the energy. The body has to take energy and force from the foot and translate it all the way up to the arms, to the golf club, to the head of the club, to the ball, to maximize where the ball is going to go. Okay, so a couple of things to remember. I said before about closed kinetic chain and open kinetic chain. So during the swing, very often the heel is off the ground or can be off the ground, and that is going to change the motion. And there are all different approaches from golf pros on whether or not it's better to keep the heel on the ground or off the ground for all different reasons. The one thing that I recently mentioned to my golf coach is when you are standing, sometimes the golf coaches will tell you to have your heels planted versus having the weight on the ball of the foot. Well, the more your heel is planted to the ground and the more you have your weight back posteriorly on the heel, the more limitation of subtalar joint motion you have. So less torque and less rotation is available to you. So I found with myself that I seem to have more rotation if I have more weight towards the front of my foot. And then on the flip side, if you're looking to increase your ground reactive forces, you want to make sure you have weight stable on the back of the foot. And there's a lot of just different factors that need to come into play when you are breaking down the swing to maximize your acceleration. Okay, so ground reactive forces, I'm not quite sure if you guys really have studied this yet, but when I was in school, the force that I learned about was really just a vertical force. And I remember learning that ground reactive forces had to do with the weight your body is putting on the ground and the force that the ground is pushing up on your feet vertically. And that is what I learned as ground reactive forces. It wasn't until I started learning more about golf that I learned that that's not the only force. While the vertical force is the primary force, there's also the force from the heel to the toe. There's a force that is called shear forces from the medial to lateral on the side of the foot. And then taken together, we have something called torque. And again, because golf requires much more than just linear gait and vertical force, we have shear forces that become much more important in golf than in general walking. So the vertical force is, as I said, is the largest component, and what it represents is the force required to oppose the pull of gravity. So the pull of gravity that is pulling your foot to the ground, the opposite of that is the vertical element of the ground exerting its force on the foot vertically. And the center of pressure represents the vertical ground reactive force at that moment. So many of you may have seen pressure mats that are used both for orthotics, also used for evaluating diabetics to see if they are prone to ulcerations due to pressure. So those pressure mats show the center of pressure, and that is where the pressure of your foot in stance or in gait is the greatest on certain areas, and that also relates to the vertical ground reactive forces. So that's different than the center of gravity or center of mass. The center of gravity or center of mass has to do with where the center of your body's mass is vertically, and it has to do with balance. So those are two important distinctions when it comes to golf, because the center of pressure and vertical ground reactive forces can influence velocity and accelerations. Golf is all about speed, increasing your speed. If you've ever taken a golf lesson, often they'll tell you swing faster, swing faster. One of the components of getting the ball further down the fairway is to increase your speed. So center of pressure becomes important because it is related to speed and velocity. Center of gravity is not, but center of gravity, meaning that you are stable and having the center of your body mass balanced, is important because you want balance. You don't want to have your center of gravity outside of where you're standing because you'll fall. So both of those become important when we're talking about your body position when it comes to golf. I know that was a lot of words, but it'll become a little bit more clear as we go along. So how, again, is kind of as a summary, how is linear gait different from golf gait? Well, the golf cycle, the gait cycle mostly puts your body mass or your center of gravity linearly from heel to toe, whereas the golf swing is dependent on all different types of torques, shears, and rotation. So again, we know that acceleration or speed increases with ground reactive forces, and that's important when it comes to golf. We want speed to get the ball further, so we definitely want to increase our ground reactive forces. We know that the horizontal forces, known as shear forces, are present, and that again goes from the heel to the forefoot, heels to the toes. and also medial to lateral of each foot. And that those forces allow you to, your foot to move and your foot to push off and allow you to go in directions other than linear. And when you take all those forces together, vertical and the shear forces, what it produces is torque. And torque is relative to spin, and it is one of the ground reactive forces, but it's the summation of the other three. So as I mentioned earlier, any muscular or tendon or even bony pathology is going to influence our ability to achieve the ideal force to allow us to succeed in golf. So this is just a diagrammic showing of how the different forces work. When you, again, vertical force is dependent on your foot being on the ground. So when your foot is off the ground, that particular foot does not have a vertical force. Vertical force increases when you are putting more force on the foot. For example, in the downswing, when you have your body is going from the back foot to the front foot, as you're bringing the club down, you are going to get an increase in your vertical forces. And likewise, when your body is moving away from that foot, as the swing progresses, your ground reactive forces will decrease. The shear forces change likewise depending on the motion that you are engaging in. When you have backswing, your weight is shifting to the back foot. And when you have your downswing, the weight is shifting to the front foot. And you have changes in heel to toe relationship as well. And as I said before, together, when you have all three forces acting together, it creates torque. And torque is defined as the amount of force that is applied from a distance on the body. Okay, so I know that's it's a lot to take in, but torque will determine the distance of the ball. So the more torque you have, the more power your body builds up to enable the ball to go its maximum distance. And it's not just the foot. You know, you have torque of the foot, you have torque of the hips. All the body parts together create torque to generate that ball to progress as far as it can go. But again, golf is from the foot up. So the ground reactive forces start at the foot, and the forces created at the foot will eventually get out to the golf club, to the golf head, to the ball, and anything that impedes that torque, the ability to create the maximal torque, is going to be it's going to affect your golf swing. So as I said, the study of the biomechanics of the golf swing is out there in the golf world. I not too long ago, I went, actually 3 years in a row, I went to one of the PGA shows, the PGA shows, that's the more commercial end. And mostly it's not really for players, it's for golf professionals. And I was there as a lower extremity specialist. And I went looking to get a little bit more information and do some research on the type of biomechanical tools that the golf instructors have. They're out there. But again, most of it is relative to the upper body. And they look, there's all kinds of you know, kind of like gait analyzers, but for the upper body. And they look at how much motion, and they look at how much range of the golf instructors that are into the biomechanics, they are really into the biomechanics, but they don't have the information that they need on foot pathology. So I think it's really an interesting field to explore a little bit further. So as I said, the golf is considered a sport that's from the ground up. You know, eventually the power that is generated from the foot makes it all the way up through the hips, through the trunk, through the shoulders and arms, and it ends at the head of the club to enable the ball to enable the maximal amount of force on that ball. So the foot is very important when it comes to golf, and there are a lot of things that we as podiatrists really can help golfers on, whether it is orthotics or shoe recommendations or maximizing motion and minimizing the impediments to golf, whether that means surgical correction or an amniotic injection to allow a tendon to heal. We can play an intricate role in treating golfers as patients. So I think this is mostly a review of what I've said already. The goal of golf is speed. Increasing ground reactive forces increases speed. So as we are evaluating our patients, we want to make sure that when they are in stance and in closed kinetic chain gait or swing, that the ground reactive forces are maximized. We want to make sure that they can transfer weight easily from one foot to the other and from the heel to the front part of the foot. We want to make sure that our patients are stable and have balance, are well balanced, so that their center of mass, it provides them with stability. And we want to make sure that their foot is well supported. So one thing that, one of the few things that golf instructors are very in tune to is foot position. And often they'll talk about your feet should be shoulder width apart. And that basically has to do with the center of mass and allowing for support. So some of you may have kids or may have nieces and nephews, and you may have experienced when new walkers, whether toddlers or even younger, when these 12, 13 to 14 month kids start to walk, you may see that their feet are wider. They're spread out wider. You may also see some elderly people who have a widened stance as well. And that has to do with balance. So the way someone walks with their stance and the width of their foot position has to do with balance, which allows their center of mass to remain in the middle of the base of support. Okay, so when it comes to golf, it's no different. People that are playing golf, it is almost innate to adjust your base of support, meaning your foot position, to accommodate where your center of mass is going. And that's just how our body works. We try to be stable, and that stability in golf is going to change. So as your position changes, it's a dynamic process. Your balance is changing. So as you go through your backswing and your center of mass is going more to the right in a right-handed golfer, you have to be able to change where your center of mass is because your foot position isn't necessarily changing. So the foot position that most instructors will say is to keep your feet shoulder width apart, because that allows for the maximum amount of balance. Then there's the issue of foot position. So should your feet be straight or should your feet be rotated externally? And that's a big debate amongst golf instructors. The one thing that I can tell you is that this is really dependent on each individual person. And I stress this to the golf instructors that I've worked with over the years, because you can't tell someone to change your foot position if you are normally abducted or adducted. That is how you are. Your hip position is also a determining factor on the position of your feet. So if you have an arthritic condition of your hips, or if you have tightness in your hips, you may not be able to change your foot position. So that information is very beneficial, or should be beneficial to golf instructors and to individual golfers, so that they know what their limitations are. So someone who even knee pathology. So someone who has a lot of knee arthritis, they may be better off in an abducted position, because that an abducted position already puts your hips in a rotated position. So it's already positioning you in that position, so the knees don't have to work harder to get you there. But there's pros and cons to both. If you go in a straight position, but your foot is normally abducted, now you're putting strains on your body parts that you may not have if you allowed yourself to go in an abducted position. So it's, I find it challenging when I hear a golf pro telling a student, no, you want to stand with your feet abducted, or no, you want to stand with your feet straight, because usually they tell everyone one or the other, depending on that golf instructor's view. But their view is universal. It's not generally tailored to the limitations of that particular individual. So there is a lot to think about. And even if you put someone in an abducted position, their hip is externally rotated, so they may not be able to load that hip in any additional external rotation. So, keeping all this in mind, the goal is to get the most rotation and the most torque. But we know as podiatrists, we know that every foot is different, and that every hip is different. So really there needs to be a better understanding amongst the golf pros so that they can better educate their students. Okay, so let's talk about us helping our patients. When it comes down to shoe considerations, one of the things that golfers already know, they know that they need stability, and they need traction, and they need support. One of the problems is that each foot does something different. So it's difficult, even when we talk about orthotics, ideally to have a different orthotic for each foot, or a different type of orthotic for each foot, because each foot has a different demand, and that demand can be different shoe to shoe. Now, some people have recommended that you have different shoes for when you're walking, as opposed to riding. I know myself, if I am walking, I need to have my sport orthotic in my golf shoes, which take a little bit more space in the shoe. So I usually pick a different pair of golf shoes. If I'm riding, I can get away with my dress orthotics, which is more of a golf orthotic, and because I'm not going to be walking. So the demands are different whether you're walking or riding, and your demands can be different for the right foot versus the left foot, not just because our right foot and left foot are different, but because the demands of golf are different. So, so it's not always a clear-cut answer. And then with orthotics, some of the general recommendations for orthotics are to have a full-length orthotic so that you don't get slipping. You want to make sure that the ground reactive forces is not impeded by the orthotic. So the ground to the shoe to the orthotic, and the orthotic to the foot all has to be an appropriate fit. You have to make sure that you're not controlling pronation too much, so that you don't get the rotation you need. And you want to make sure that there is no friction or no sliding. Okay, so you don't want to interrupt anything that's going to you don't want to interrupt any normal process of ground reactive forces. And you also want to make sure that you don't do anything that changes the proprioception that might change your balance. So as I said, a lot of things can be explored, should be explored, and I think this is an area really that can help the field of golf. Whether our muscles, if you have a muscle function if you have a muscle that's not functioning appropriately, it's helpful to know what phase of swing that's going to affect, because then you can try to accommodate for that. If you have pathology, you can change your swing so that you have the ability to overcome that pathology. And of course, we all know that most of our athletic patients don't like to rest when they need to. So that becomes a factor in golf, just like in runners. And really the foot position, I think, is a big one. You know, someone with a cavus foot versus a pronatory foot is really going to change the recommendations that are made for them for golf. So a few things that I did find out there when I did the initial research on the studies that were out there. One was a study of balance, and this really wasn't any earth-shattering discoveries. It really had to do with the center of mass and balance and the center of force. So it was a pretty basic study that I saw. The other thing that I came across was shifting of weights and theories. There are a couple people out there that are more in tune to the lower extremity than others, and this is one guy's work, T.H. Tischler, and most of the things that I've read and the things that I've spoke to talk more on theory, general theory, and not so much on individual foot function or pathology. So there are theories on whether or not to pronate, whether or not to supinate, whether or not to stand with your foot abducted or adducted. But again, it doesn't take into account the individual patient. One of the guys that I spoke to, who he's probably the most in tune with lower extremity biomechanics, and I'm going to play this video for you in a minute if it'll work. Yeah, I think it'll work. He was telling me, he was talking about how the newer instructors are telling people to keep the hind leg or the back leg, the heel planted, meaning don't allow it to come off the ground. And in our terms, it meaning don't allow it to supinate. So he approached this as, his explanation was that newer instructors were telling their students to control the motion. But what I think that these instructors don't realize is a lot of this motion has to do with things that are not controlled. And I'm going to play this video in a minute. He's talking about, in this particular golfer, the right foot. He's a right-handed golfer. So the hind foot or the back foot, which is his right foot, when he goes to his backswing and he rotates in his backswing, his tibia is going through external rotation. And we know that external rotation of the tibia is going to cause inversion or supination of the foot. So that's something that is going to automatically happen. So he put this together to try to show me how the newer coaches, when they tell people to keep their heels planted, that they shouldn't do that. But we know as podiatrists that if you are externally rotating your tibia, your subtalar joint is going to go into supination. And so this is just one example of how they're trying to, some of these instructors are trying to analyze it and evaluate what you should and should not do. But we as podiatrists have more knowledge and know that that's the body's way of naturally moving. Okay, I'm going to play a little bit of this.
Okay, Marlene, this is a young kid that's won 2 tournaments in a row this year, and he's really a good, ball striker, really a long hitter, and he's not even the biggest guy. He's 5'10" and maybe 150, 60 pounds. Okay, so what we're seeing is, okay, on the backswing, his right foot, and I'm gonna zoom this in so you can see a little better. On the backswing, there is movement of the foot, which is supinating, and here. Okay, sorry. Here we go. So at the very top of the backswing, did you see that? So his foot went from planted to the top of the backswing. It is making a small movement to supination. There you go. So the foot rolls, and then from there it'll plant, and then you see plantar flexion, and then you see the pronation. I think if you ask 100 teachers out there, they would say that it's pronation early, and that's why you get the wrong idea. Now let me go find some other guys because I don't want to make this to be just about one guy. Okay, so this is Lydia Cole, #1 woman, and you see that same movement of the foot. So again, it's planted, starts the backswing, nearing the top, you see that slight roll of supination, right? So the foot wobbles a little bit, little supination, then it's back down. Okay. Okay, Thomas Peters, one of the best young guys. I think he's out of Belgium. You might even see a little bit of inversion on that right foot. So there's inversion, a slight bit of supination. Right? Even a small movement like what we're seeing is a movement that's important, because if it's happening and we're saying it's not supposed to be done, then it gets people overly concerned with keeping the weight on the insides, and early, what's called early right hip IR is what typically happens, and that's not what we want to see. Again, there's the pattern, and then you see plantar.
So again, what's the component that's missing here is that your hip, the ability of your hip to rotate, the ability of your tibia to rotate externally is going to influence on what that foot does. But the other factor too is if that heel is not firmly planted on the ground, it's going to change from closed kinetic chain to open kinetic chain. But it's also going to change the amount of vertical forces or ground reactive forces. So there's a whole lot of components that go into making the swing, maximizing the swing as much as possible. And a lot of these coaches, they just pick up on something like, okay, you want to invert. Well, what does that mean, right? So they may know what it means, or they know what supination means, but they don't know why it's happening and why it really can't be controlled based on an individual. So I find it really interesting how, and I've been around a lot of instructors over the past few years, and I find it really interesting that most of them seemed, and these are good instructors, they are good at evaluating what they're seeing, and they're good at understanding motion and understanding body motion. But what they don't understand is foot pathology and how that's going to change the body's ability to accomplish what they're trying to get their clients to accomplish. And I'm going to close with a couple keys for tips for winter in the golf. Those of you that live in the Midwest or the Northeast or even Texas these days, you may not have played golf in the winter when sometimes there's snow. One of the things that I've learned is dress in layers, because I found myself always taking off my coat when I got hot. There was always mud. There was never a place to really clean your ball, because the holes are kind of all mud, and there was goose and pigeon droppings all over. So sometimes it was even hard to see your ball from a distance. But golf is a great sport, and as I become more in tune to the biomechanics, I find it even more challenging. But definitely, it's a great sport for podiatrists. And thank you all. Good luck with the rest of your conference, and I hope to meet you in person one day.